Welcome to Observations, an open conversation about women's health. This is a space where physicians, patients, and other experts can sit down and have honest, evidence-based dialogue that cuts through the media bias and brings clarity back to maternal care and how we can care for both patients, mother and preborn child. With each episode, we will have real stories, real science, but also real questions about women's health today. From clinical insights to lived experiences, to aligned perspectives, and yes, also respectful disagreements. This is our goal, to bridge the gap between physician and patient, to empower informed decision-making, and bring back and elevate compassionate, fact-driven care. Now, a quick note before we dive in. Not every guest on the podcast is going to represent the views or positions of Applog, but we believe that having open and honest conversations are going to make us better. So, grab your coffee, settle in, and let's get into today's observation. Welcome back to Observations. I'm your host for today, Jordan Butler. I'm the communications manager here at Applog, and we're recording this from the MBEC 2026 conference, and I'm really excited to have Dr. Callum Miller here with us today. He is a medical doctor and a research fellow at the University of Oxford, where he teaches philosophy and researches abortion policy from medical, ethical, legal, and sociological perspectives. He graduated from the University of Oxford Medical School in 2015 and holds a master's degree with distinction in biblical studies. Dr. Miller has also published over 30 academic papers on the topics including maternal mortality in the developing world, the empirical impact of abortion bans on women, the ethics of voting on abortion, animal and fetal pain, abortion and mental health, you've been very busy, telemedicine abortion, academic freedom, and the philosophy of religion. He has also received prizes from the University of Oxford and the Royal College of Psychiatrists for his work on bioethics. So we're very excited to be talking with him today. Dr. Miller, thank you for being here.
Thank you for having me here.
Yeah, and I did kind of want to ask this question just based off of just this introduction about you. What made you interested in researching abortion specifically? Like, how did you end up there?
Yeah, good question. I think it was a number of things. One was that, I became pro-life in medical school, and that was a surprising change because the large majority of my country is pro-choice, or at least was until recently. And so I kind of got into this area, became pro-life, and thought, wow, someone needs to start talking about this, and I felt pretty strongly about it. I saw, in my country now, not at the time, but now it's 1 in 3 babies are aborted. So it was a huge issue that needed someone to be talking about and researching. And then it was also just an incredibly interesting academic area because even just in the philosophy alone, it involves questions about what is a human, what gives humans value, when is killing okay and not okay, what gives us a personal identity, what about the place of equality and things like that. And then it also has all these other questions outside philosophy, like the questions of law, questions of mental health, physical health, and all these other issues. And so even just for a neutral observer, it's like just a super interesting thing to study. And so I got into it that way initially and then felt it's great that this can have an impact in the real world as well.
Yeah, well, it's certainly you've had an impact in the United Kingdom, and then you obviously have an impact here in the United States. I wanted to kind of talk to you a little bit about your research and also just how you combat some of the certain things that come about. At least here in the United States, I'm sure you obviously know, like Roe v. Wade was reversed. And since then, abortion has been brought back to the states. And so we've seen a lot of media that's like, hey, these pro-life laws are going to confuse doctors about whether or not they can save a woman's life. And this is a pretty common media talking point. We have a media outlet here, it's called ProPublica, that has put out multiple stories about women that they've died from some sort of abortion, chemical abortion, and then blamed it on pro-life law.
Right.
So for maybe the pro-choice person that might be listening or watching this podcast, what would your response be that pro-life laws actually put women at risk?
Yeah, I think there's a few different variations of this argument, and the one that has been most common in the US has been to say that pro-life laws are inevitably vague and they don't let you treat women in certain cases, in emergencies or in life-threatening conditions. Sometimes they go even further and say they don't let you treat miscarriages and things like that. I think especially looking at it from an international perspective, it's very easy to see how crazily dishonest this is. And sometimes when I've engaged in this debate in the US, I've just said to people, look to other countries. The large majority of countries in the world do not allow abortion except in these extreme situations. And yet they do not have women dying left, right, and center from miscarriages because the doctors felt they couldn't intervene, or because the woman was septic and doctors felt like they couldn't intervene. There are countries like Poland and Malta that are almost entirely pro-life. Malta only allows abortion if the mother's life is at risk. It's exactly the same as the strictest American laws, and Malta has had no maternal deaths in 12 years. So even just looking at it sort of just from a basic logical standpoint, all you need to do is know a little bit of history, a little bit of what actually happens around the world to see that pro-life laws just do not inevitably have this effect. Now, the sad thing about that is that it seems that some pro-life laws in the US have, in an indirect way, led to these consequences. But the reason is not because the pro-life laws are bad, it's because pro-abortion activists and ideologues have deliberately misconstrued them and actually scared doctors.
So they're the ones that are causing the confusion.
So they're the ones that are causing it, and they're the ones that are responsible for it, because it's kind of like saying, look, there's a law that's perfectly fine, but we're going to scaremonger and tell doctors that it says something that it doesn't so that they don't intervene. Now, it's kind of horrible to think about how evil this actually is. That in order to simply make an argument for an abortion, which you can make in other ways, they are willing to lie to doctors, effectively telling those doctors not to intervene and let the woman die in order to sell this narrative. So it's very obviously not a case of the pro-life laws being responsible for those situations. It's actually far, far worse than that for the other side, because they are deliberately putting doctors and women into those situations as a way of falsely smearing these laws. So it's very sinister.
It's incredibly sinister. I mean, I think that's what happens when you use fear as like a driving motivator. And what's so interesting about you talking about this is that you're referring to statistics, but then you see the media referring to these one-off stories that they've construed for their own purposes.
Yeah. And you know, I think I did a piece for National Review on one of these cases. And again, when you look at the way these cases have been misreported and misunderstood, it's really crazy. You know, you hear all of these stories. In some of the cases, the woman didn't want an abortion, and they make this argument in a few other countries. They try to make these arguments in Poland and other places. In Poland, one of the biggest examples that sort of blew up in this area, the woman didn't want an abortion. And yet they were saying because she was denied an abortion, she died. She never wanted an abortion in the first place. And yet people are blaming the fact that supposedly she couldn't get one. So this happens a lot. They sometimes use this tactic in other countries. But what's heartening is that in certain other countries, the medical profession is sort of honest enough to really publicly respond to them. So there was a case in Malta a few years ago where an American woman flew over to Malta, had a situation. It was claimed by her that her life was at risk. The doctor said her life is not at risk. We don't need to intervene. We can protect her and the baby. She, a non-medically trained person, disagreed, flew to Spain to get an abortion, and then concocted this narrative that, the Maltese doctors threatened my life and I was going to die, and it was only because I had this traumatic last-minute emergency trip to Spain that my life was saved. She sued the hospital, and essentially what came out in the court proceedings was that her life was never at risk in the first place. all the top doctors of Malta testified and said her life was not at risk. She did not need an intervention. And when they tried to change the law to legalize abortion because of this, there was a big sort of public campaign to say we need to change the law so that this never happens again. The Maltese Medical Association came out and said, this is totally unnecessary. Women are perfectly safe in Malta. We do not need to change the law. We have the best maternal health record in the world, far better than the United States, far better than any pro-abortion country. We can keep our pro-life values and protect women as we have been doing for the last however many years.
Right. And so we kind of have a little bit of an opposite problem in the United States, where you're saying, in Malta, they're like, women are perfectly safe. Now we have the FDA saying, well, women are perfectly safe. Maybe that's not exactly what they're saying, but they're saying that women are safe with this chemical abortion situation. And as you know, like, we had a lot of the REMS removed, essentially. There's no in-person visits.
Right.
Anyone, like literally anyone, can get these abortion pills online. Can you kind of just explain a little bit, like, from a researcher perspective, like, why it's not safe, and maybe also explain the FDA's role in it besides just saying that it's safe?
Yes, yeah. So there are a number of things that are unsafe about it, and I've published papers on this. I've given presentations to people in parliaments about this, and I wrote an amicus for a current Supreme Court. Is it the Supreme Court, I think?
Or maybe I don't think it's quite the Supreme Court yet.
It's earlier in the proceedings. I did it for a previous Supreme Court case, and now it's at a new Supreme Court case on the same theme. Oh, sorry, a new court case on the theme. Essentially, the question is, did the FDA sort of abdicate their responsibilities when they removed these safeguards? Because this is not just a medical question, it's also a legal question, in that the FDA has a legal responsibility to rationally assess their actions when it comes to approving drugs, withdrawing drugs, putting safeguards on them, and so on. So not only should they be rational from a sort of intellectual and ethical point of view, they have a legal obligation to do this process in a way that is logically and intellectually and academically defensible. And so what I point out is that they really did not do anything credible to make those recommendations. So they removed these safeguards, saying that women had to, go in person and have an ultrasound and so on.
Right.
Now, the reason that's so dangerous, there's a number of reasons. The first is that pretty much the main way that women who were being trafficked or abused, who were then going to get abortions, the main way that those women were identified and then given help was through an in-person consultation. If you look at abortion provider websites, even to this day, some of them still say, there's an FAQ that I'm thinking of one abortion provider in particular. The FAQ says, I'm being pressured into an abortion, what should I do? And the answer is, don't worry. You will be seen in person with no one else, whether it's your partner or your pimp or whatever it is. You will be seen alone so that we can make sure that it is really your decision and no one else's. Well, of course, if you say that women can just be mailed pills in the mail, there's no way that you can actually speak to the woman and be sure that there's no one else there with her, ordering them for her, or coercing her into the answers. So the first way is women's safeguarding. The second is ectopic pregnancy. So typically you would do an ultrasound to make sure that the woman does not have an ectopic pregnancy, because if you give a woman with an ectopic pregnancy the abortion pills, they won't do anything. And all that will happen is she will then eventually rupture her ectopic pregnancy, start bleeding, have a massive hemorrhage, her life will be at risk. Not only is that a problem to begin with, but then she will think, well, I was told that from the abortion I would have pain and bleeding. So the pain and bleeding that I'm feeling now is probably just the abortion. It's nothing to do with having a tummy full of blood and about to die.
Right.
And so that's a second way that it's been hugely dangerous. There are other ways as well, but those are two of the key things that people have raised concerns about.
Yeah, and so, AppLog has been raising these concerns pretty much nonstop, and ACOG really hasn't said anything, and as I was reading your amicus brief, you were even talking about in the UK where they were like, this is actually a problem. And that's very interesting because would you say like the UK is pro-life, but yet they seemed like they were like, yeah, we should probably do something about these abortion pills, right?
Yeah. I think the one silver lining of being on a continent that is so overwhelmingly pro-abortion. So in my country, it's about 5% that's pro-life historically. One of the silver linings of that is that they have become a little bit more honest and moderate because they feel like this is not a big political issue. So in the US, they know that in a lot of states, there's a genuine opportunity to bring back protections for unborn children by restricting abortion. And so the pro-abortion activists feel like they have to fight for every single little thing. They cannot sort of allow any pro-life talking point to be at all acknowledged or given any credence. Whereas in Europe, they kind of know that there's no significant resistance to abortion in most countries. And so they can talk a bit more freely and a bit more honestly. And that's what we found, which is that, you know, in the UK, two of the largest entities in the health service responsible for protecting children, the Royal College of Pediatrics and the National Network of Designated Healthcare Professionals, whose main role is just to safeguard vulnerable people. That's their job, is safeguarding. The two of them are pro-choice. They say we support abortion access. We're pro-choice in that sense. But this is so dangerous for children who might be being coerced into an abortion or being abused, because they will not be able to be identified that they are in an abusive relationship or being trafficked or whatever it might be, because we don't know that this is really them making the decision, because they're just going to go and be sent pills in the home without necessarily having medical supervision or the knowledge to know when there's a problem. They won't have parental oversight necessarily. They said this is just such a huge safeguarding issue that we have to oppose it. And they even went to the level of not just making a statement, they were actively lobbying our congressmen, the parliamentarians, to not allow this. In the Netherlands, it was even more significant because this is one of the most pro-abortion countries in the world. They have one of the latest abortion limits in the world, as does the UK, in fact. And it wasn't just these sort of, pediatricians and other groups that were responding to it. It was the abortion doctors themselves. So the Society of Abortion Doctors and the Federation of Abortion Clinics themselves both said this is not safe to just send pills in the mail. They have to be seen by a doctor. And so if you have even the abortion clinics and doctors in one of the most pro-abortion countries in the world saying this is not safe, then you can really be assured that this is not just pro-lifers causing a scandal because, we oppose abortion. There really are genuine safety concerns here.
Yeah, and I think one of the things that I'm thinking about is, you're talking is that political climate really does put women's health at risk, or to a certain extent, I guess, in the UK, like, because you said that there's that lack of resistance, that they're actually brought about some common sense. So that's actually very interesting.
But it's not a reason for pro-lifers to give up.
No,
it's a silver lining, but it's a silver lining for a very dark cloud. So.
Right. Yeah, I mean, that totally makes sense. So there was another question I wanted to ask you, because I'm not a doctor. I'm not a researcher. I'm someone that, consumes the media. I work in communications, and we'll see articles all the time that it's citing a study, right? And I was, in a little bit of your talk, I had to go back and forth, but some studies are not good. But when someone like, just a normal person sees a study, they're like, oh, well, this study says that this is okay, so they just kind of stick with that study. For the person that's not a researcher, not a doctor, what are some ways that we can look at studies and determine if they're actually worth taking at face value?
Great question. And I would say it's increasingly challenging because in the past you would have genuine debate in medical journals about certain things. And on certain less political issues, you still get that. So, when people are talking about, what's the real cause for schizophrenia, it's not a massively political question. And you get, letters to the editor, responses to that. You get comments on articles and then responses from the authors. But when it comes to the issue of abortion, the medical sort of fraternity is just so monopolized by pro-abortion activists that it's very difficult for that kind of legitimate debate to be had in journals. Sometimes there is. So I would always look, and I think PubMed for any medical article usually says this article was cited in, and then a few other papers that came later. Some of those papers might give a counter perspective. It might be a helpful place to start, although it's quite rare.
Okay.
There will be other entities that will have professional researchers and doctors that are able to respond to this, and it might not be in the published literature because of that sort of politicization, but it might be that they've produced videos or articles or blog posts or whatever it might be responding to these articles. So I would always go to a group like APLOG or like the Charlotte Lozier Institute. On my website, callumsblog.com, there's often a lot of stuff responding to some of these articles that are frequently cited. Secular Pro-Life actually does a lot of great articles on this theme as well, just debunking the latest sort of ideological pro-abortion articles. So it's difficult to sort of gain the skills yourself to just do it for every paper, and it can take a lot of time. But I would say that those would be great places to start. And if you look through, you know, some of the previous examples, like Secular Pro-Life, search their website for misleading papers and see how they approach it. That can just train you to be able to spot the same problems with other papers as well.
Yeah, and having a critical eye for sure, and you know, asking great questions. And so when it comes, I'm gonna kind of pivot us a little bit. When it comes to the United States, from your perspective as someone who's in the United Kingdom, what do you think are some of the unique challenges that we have here that pro-life doctors face, and you know, maybe some potential ways that we can overcome them?
Yeah, it's a good question.
It's a loaded question. I'm sorry.
I don't know if there are any unique challenges, because there are plenty of countries where, you know, the medical establishment is really dominated by pro-abortion ideologues. I think, as I said earlier, it kind of is a fairly unusual situation to be in, where you're literally having to combat blatant misinformation of this scale. So in most countries that prohibit abortion or restrict it significantly, as some American states do, there will be misinformation about this. People will say, look, women are going to die because they can't get access to abortion, so they do dangerous, unsafe abortions, which can cause sepsis, and they'll die from that. That kind of argument is quite common in other countries, but the argument that, you know, women cannot get miscarriage care or they cannot get ectopic pregnancies treated, I know people in about 140 countries in the world, and all of them are through talking about abortion. So I have talked about abortion in the large majority of the world's countries, in dozens and dozens and dozens of countries, and done a lot of research about the global situation. I have never heard someone say that a woman cannot get a miscarriage treated or cannot get an ectopic pregnancy treated because of the abortion law. It was, when I first started hearing that in the US, it was so insane to me that that they would even try to say that. So
it's
then
a huge talking point here.
The fact that it actually got some traction was even more astonishing. I was like, no one is going to believe that, because it's so insane, so obviously false, and yet some people believed it. So I think that is, an indication that the US has an unusual level of misinformation, but not only the sort of misinformation in the first place, it has an unusual level of protection for that misinformation, so that it is allowed to breathe and given really serious traction. I think that's pretty unique here.
It is, yeah. Like your major news outlets are more than happy to repeat those things and kind of indirectly imply it as well. Right. And so in that regard, when it comes to that misinformation, and then what you say is protected misinformation, what can pro-life doctors do here in the States? Like, is it really as simple as just speaking out or testifying or talking to the media? You know, what's just kind of what, from your perspective, would you do?
Yeah, I think there's a number of things, and I think APLOG is the best place to jump into that, to begin being part of this. But I would say speaking out is something great to do, and the more people are speaking out, and the more you're training younger doctors to speak out is great. It will make a difference. But I would say that there's a temptation to do something like come to an APLOG conference, hear this great content, maybe speak out in small ways, but without really thinking through how can I affect the systems that are perpetuating this dynamic? By which I mean largely, the medical boards, the professional societies, and the journals. And what I would say is social movements normally happen through a minority of people that are very dedicated, who go into something and, a dedicated 20% will outweigh a passive 80%. So it's not that you necessarily need to get absolute majorities everywhere, it's that you need to get into positions of influence, whether it's in journals or boards or societies and so on, and stand firm in those positions. I think APLOG can train you to do that in a strategic way, and there'll be other organizations that do that. But also get involved in the academic process. Write articles, submit them, and once you do that, you'll find that not only are you contributing to the literature, you will also get invitations to be a reviewer for other articles. And once you're a reviewer for other articles, you can give important counter perspectives. I'm not saying just, force the author to make everything pro-life. That would be irresponsible and bad scientific practice. But what you can do is you can add balance to the academic debate by being in those reviewer positions. And that typically takes just writing some articles, getting them published. And there's a lot of areas where there is a need for academic research. So it's not like we're sort of scrambling to find articles and topics to write about. There are so many areas that you could actually write a pretty interesting article that could be published on this area. It's hard to publish a pro-life article, and by that I don't mean sort of ideological, I just mean an article that in any way raises questions about abortion. Even if you're pro-choice and you have questions or you write something and your results are not that convenient, you'll struggle to publish it. But it is possible. There are journals out there which will publish different perspectives and will be more open about the scientific evidence. So I would give it a go and keep trying.
Yeah, no, that's good. And kind of on that note, speaking about like the younger generation of doctors and the medical students and the medical residents that we have here, like there is a lot of fear, especially like here in the United States. One thing that APLOG is pretty consistent on fighting for is conscience rights. For our medical students and our medical residents to make sure that they can change it from abortion training from opt-in to, hang on. It's opt-out. No, we want to change it to opt-in, then opt-out. Yeah. It took me a long time to get that. But what would you say to just the younger generation that if they're scared, because all of that sounds really great, but it's like fear is like that block, right? That like stops you from even trying. And you kind of said, you kind of moved into that abortion research. Like, what have you done to kind of tackle that fear and do that research anyway?
Yeah, I would say, firstly, don't be afraid, because this is much more important than, the career opportunities you might have. I'm not scared that I'm going to get to the end of my life and be worried that, I could have got a slightly better position at a hospital or something like that. I'm going to be worried, did I live my life well? And that's the question that all of us are going to reflect on our deathbeds, and that's the most important question. And nothing in terms of your career is going to everything career-wise is going to pale into comparison in terms of the integrity you had, the decisions you made to make the world a better place. And it's very fulfilling. I think a lot of people get to the top of the career ladder and they're totally miserable, and we see that all the time, especially in medicine. A lot of people don't do as well, but they have done the right thing. They have had a great family, they've served their community, they've served their country, and that is a life well lived, and they will feel more fulfilled as a result of that. So that's the first thing. But the other thing I'd say is get prepared. I think the biggest mistake people make is they sort of stick to their guns. They do the right thing, but in a kind of clumsy way. And then they might need to take legal action, for example. And then it turns out, and when they speak to the lawyer's like, these facts are not great, in the sense that like you could have handled this a little bit better procedurally, even though you did the right thing morally. Yeah. From a legal point of view, we can't help you as much because you handled it in a way that was not kind of optimal. And so lawyers are always looking for that kind of thing. And so I would say, before you get into these situations, have a really clear understanding of what situations could I get into. If those situations arise, what am I going to do exactly? When am I going to speak out? When am I not going to speak out? And if I do speak out, how am I going to do that carefully without saying the wrong thing? Then run that by one of these groups that does a lot of freedom litigation, like Alliance Defending Freedom or Beckett Fund or groups like that, so that they can tell you, yeah, that's a good way to handle it. This is maybe a way I'd improve it, so that you are genuinely prepared with the right legal advice before you get into the situation.
Yeah.
I'm not saying that to scare people. Most people are not going to get into legal problems. But if you're worried that that's what could happen and that you could be sort of discriminated against or persecuted, then the law is there to protect you. There are strong conscience rights, strong First Amendment rights, and so on. And understanding the law and how you can best be prepared to use it to your advantage is a really important tool that you have to protect yourself. And so I would say, be prepared in advance. There are tons of organizations that are there to protect you and to give you that advice, and they would rather give you the advice before it than afterwards. I think even APLOG has a new manual on conscience rights. Is that right? I think I saw something at the conference.
We have a medical voices masterclass, so there is also like that legal like training as well, and then also that media training. But that's one of the cool things about being a part of a group like APLOG. Bias, but one of the best parts about being part of it is that you can have like mentorship, from other doctors. You have a group like we've told, medical residents and students if they see anything or anything has happened to them that violates their conscience rights, we can support them.
And one of the biggest problems is not knowing the right people. We had a case maybe in the last year in Scotland, where there was a midwifery student who was basically struck off her course for being pro-life. It was really as outrageous as that. And she very nearly just had no help and had no way to get back into it. And it was only because we managed to connect through Twitter, and then another sort of mutual friend of ours mentioned it to me, that I thought, oh, that sounds like a really serious situation. I better offer some help. And I did, and there was some legal action, and she won, and she was reinstated. But it was so close to her just being kicked off the course with no recourse, simply because she didn't know the right allies that could help her. So getting connected to a group like APLOG, where you can always ask those questions, is really key as well.
Yeah, and what you're saying is true. It's like you need to morally stand up for what's right, but that doesn't mean that you can't do it in a smart way. And that's what you're saying, is being strategic about it. Yeah. I think we're about ready to wrap up, but is there anything else you'd want to add? Like anything at all before we wrap up?
I can't think of too much else. Just come to the APLOG conference if you haven't been before. It's a great conference. I always say, and I'm quite a critical person, so I'm kind of harsh, that like most conferences, the content is kind of pointless and boring, and it's not really that worth going to, at least for the content. You go for the people. Whereas APLOG is one of the few conferences I go to every year, and it really is because the content itself, even for someone who spends their whole life researching this and talking about it, the content is really exceptionally good, and you learn great, useful material every time. So I wasn't paid to say that, but it's true.
I was going to say, that's a very high compliment. Well, we love having you every year, Dr. Miller. It's always a pleasure to have you at the conference. And thank you so much to our listeners and our viewers for joining us for this episode of Observations, and we will see you next week. We are so excited to just highlight one of our incredible sponsors for our MBEC 2026 medical conference, which has already come and gone. Can't believe it, but our sponsors, they keep working around the clock. With us today, we have the Charlotte Lozier Institute, and with us is Dr. Calum Miller, who is the Director of Life Sciences at Charlotte Lozier. He was also at the MBEC conference, which we were so excited to have him there. Cameron, thank you so much for joining us today.
Thanks for having me on. It's a pleasure.
Yeah. For people that might not be aware what the Charlotte Lozier Institute does, can you just kind of give us a little bit of a synopsis?
Absolutely. Yeah. Charlotte Lozier is a research organization that brings scientific, statistical, legal policy analysis to bear on the life issues. We've got a staff of 13 that are working hard on that, but then we also have a network of associate scholars, and folks will find a lot more information about them on our website. There are 70 or so of them there. That they're folks in kind of all corners of professional fields and practice, medical professionals, academics, researchers, scholars. And so they also bring that expertise to bear and contribute to that research and educational mission.
Yeah, and the work that you guys do is so important. Even in my time in the pro-life movement, when we would see an article come out, like whether it's a news article or a journal, like we would go to Charlotte Lozier and see like the just plethora of resources and studies and analysis that really helps the pro-life movement make sense of a lot of the media bias that comes in when talking about abortion. Um, just for your role, Cameron, what exactly do you do?
Yeah. Yeah. So as you said earlier, director of life sciences, and what that looks like is the all the spheres in which biomedical research and science in general intersect with these life issues. Those are spheres that I spend time in. So I've been working a lot recently in the abortion drug space, but you can imagine the roles for the life issues extend more broadly too. So I work on our prenatal development resource, which maybe we'll spend some time talking about a little bit here, but also stem cells, fetal tissue, embryo research, prenatal diagnosis, reproductive technologies. So all of those spaces, those are spaces that I sit.
Yeah, and those are very wide
Absolutely,
topics too.
yeah.
There's a lot going
There's a
on
lot
in
there.
each
There's a lot
one
there for
of those.
sure.
Yeah, for sure. But I know that a lot of people, which is a good thing, that they're becoming aware of the dangers of abortion pills. And not just that they're, dangerous, but that they are so widely accessible to people. Um, can you talk a little bit about Charlotte Lozier's and some of your guys' initiatives and perhaps some of the work that you guys are doing in regards to abortion pills?
Yeah, yeah. So we've got a lot going on in that space. I can speak probably most in particular to some of the work that I've been directly involved in.
Hmm.
So one of the spaces that I'd say over the last year, I've certainly been working on. We've put out a decent bit. Is in some of the messaging around abortion drug safety. So in last summer, we put out an article that dug into the comparative claims that are offered a lot in the media and the social media, but also the legal and the policy space all over. The listeners may well be familiar with them, that abortion drugs are safer than Tylenol or Viagra or penicillin, or there's a litany of drugs that one might insert or find inserted into those phrases. So and in summer of last year, we put out an article that really kind of dug into those, right? Because one of the things that we hear a lot in that space is that um, sometimes those are just presented as factual statements, but sometimes they'll also be associated with the backing of the science, right? So there will be an assertion that the
Mm,
science and the data backs these statements up. Sometimes you'll see citations offered for them, right? And so this paper really dug into those in detail and asked the question, okay, for those citations that are offered, the data that uh, undergirds those slogans, um, does that actually support the claim that's being made, and is it the type of data or information that we would expect for a statement of such importance, right? A drug safety statement. And the answer
mm-hmm.
is no on both counts. The data is woefully inadequate to support that kind of statement. What's really happening there is that you can look and find it yourself in the sources that are offered. Folks are just kind of grabbing numbers from different sources and saying, okay, well, I found this number about this mortality rate here, and this number of this complication rate here, and kind of putting them all together. And that's how we get a lot of these slogans. That's how we get this space where um, a, a lot of drugs are being offered as comparators to mifepristone. And I think intuitively we realize that it just doesn't make much sense. It's not actually helpful to compare two drugs that have nothing to do with each other. It's actually very confusing and harmful in a space where we're normally quite cautious of our messaging, which is drug
Right.
safety. And so, yeah, so we put out that article in the summer. And we've been spending more time in that space too. I invite folks to read the article. It's open access, so anybody can access it. It's in the journal Biotech. But we've also been spending more time in that space because those particular claims, each particular drug that's presented, those are problematic, and we should call them out as such. But it also speaks to a broader issue of how we are communicating the safety, or how we've kind of accepted the communication of the safety of abortion drugs, because we see a lot of these slogans appearing, these slogans that are appearing just as fact, and they're appearing not only in the media, but also in front of the Supreme Court, right? We have politicians saying them, right? So they've really kind of caught fire in that sense. And so we're doing more work in that space, and we're excited to continue to contribute to that public conversation that this is just a wholly inappropriate and problematic way to be talking about the safety. It's reductionist, it's dangerous, it's highly inappropriate. And so we're continuing to work in that space.
And that's incredibly important, especially for the pro-life movement, because of course, any common sense, person would be like, wait, this cannot possibly not just be as safe as Tylenol, but safer than Tylenol.
Yeah.
Like, that's a pretty bold statement
It
overall.
is. Yeah.
And to not only be able to say, hey, it isn't safe, but have, you guys, Charlotte Lozier Institute, actually putting science behind that and giving, something to present is incredibly important, and it's a very educational resource. And we'll make sure that we put that put those findings in our show notes down below, because it's incredibly important, and we really appreciate your guys' work in that regard.
Thanks so much. Yeah, I mean, that's our goal is to contribute to that public conversation, right? And this was certainly a place where things have gotten out of hand, and there was there have been a number of efforts over the years to call these claims out for what they are. So I'm hopeful that this is just another tool that is helpful to that end. Yeah.
Absolutely, yeah. And you talk about, being a part of the public conversation, and I think that's one of the things that is really cool about MBEC, especially this year. It's just our theme was forging a new path forward, but even our keynote speaker, Professor Robert George, is talking about being, courageous and being willing to speak up. And I think that's so important. And so in regards to MBEC itself, we're so excited that you guys are a sponsor. But what made you guys decide to sponsor, and what was like one of your favorite parts about MBEC?
Oh yeah, favorite part is hard. I really enjoyed all of it. And in terms of sponsorship, Charlotte Lozier and Applog have been we've been close collaborators for a long time. Obviously, share support for their mission and the work that they do. Who share a commitment to bringing forward this research to inform that public conversation. Right. So there's a lot of alignment there. And in fact, we work closely with a lot of members and board members of Applog. A number of them are our associate scholars and contribute
Yeah.
regularly to our research mission too. So there's a lot of close collaboration with Applog, and we greatly support their mission and their work. In terms of the conference itself, goodness gracious, every talk and the lineup was incredible. It was so edifying. There was such a diversity of information and wonderful speakers and breakout sessions. For me personally, it's such a joy to be in that environment, interacting with all those folks, right? Folks that we know because we've worked with them closely, and it's such a joy to just be there together with them and share that experience, both of community and then also of education and learning, right? But then also to meet new folks, right? The fact that MBEC has all of these students coming every year is such a joy to meet them and to draw encouragement from them and encourage them as well. So, yeah, it's a great conference, and we were thrilled to be a part.
Yeah. We're just so thankful to collaborate and have a partnership with Charlotte Lozier. And it's been wonderful, and always so happy to have you guys at MBEC. Cameron, thank you so much for just taking the time to speak with us today. And for those that are listening at home, MBEC is come and gone, but we will be back in 2027 in St. Louis, Missouri. So very, very excited. Cameron, thank you so much for being here, and we will see you all next time.
Thanks so much.
We hope that you enjoyed today's episode of Observations and that it broadened your perspective on women's health and how we can care for both patients, mother and preborn child. If you like this episode, make sure to give us a 5-star review where you can find your podcasts. Make sure that you like this on YouTube and subscribe to our channel for more episodes coming up. And if you have any suggestions on any topics that we should cover or guests that we should have on, make sure that you email us at media@applog.org. Again, thank you for joining us for today's observation, and we'll see you in our next episode.